Hello again, everyone. Welcome to part two of the lecture on chapter three, ethical, legal, and professional considerations in assessment. Where our first part or our first section of chapter three really focused on the standards and guidelines for evaluating tests and their test usage, and really a heavy focus on the codes of ethics. This half of our lecture is going to focus more on the key ethical and legal considerations within assessment. So, more specific things that we need to focus on. So, to start this chapter, I want to highlight that there are a number of situations in which ethical principles are called into question when psychological tests are used in counseling and placement. And when we're talking about placement, this can sometimes mean whether or not we determine that our client needs to be placed in a higher order of care, or if this could mean something related to their education or access to different jobs. So, two major interdependent considerations are counselor competence and client welfare. As counselors, we need to consider counselor competence and client welfare issues during the assessment process, and we are to review the ethical codes and professional standards of the counseling profession. So, in terms of counselor competence, counselors are to be mindful of your knowledge level. And it's our responsibility to seek additional training as needed when we are developing or using existing assessment tools. Similar to that, we as counselors have to abide by the standards that are set by test publishing companies because several test publishers have codified four competency levels based on the type of qualifications that are needed, and these qualification levels determine who can purchase and use different assessment tests. So the first of those is level A, and individuals who have level A can conduct assessments with no specialized qualifications. So anyone can administer a level A assessment. A level B assessment typically requires at least a master's degree in a field related to psychology or education. They also obtain appropriate training, or they have a particular professional memberships that will provide them with the training that they need to give these assessments. So that's the level B assessments. We also have level C assessments, which are usually ones that require doctoral level education in fields related to psychology or education. Those individuals have appropriate training, or they have credentials that require assessment training and experience. So this might be someone saying that they're getting certified to conduct a very specific assessment in addition to their training that's likely at a doctoral level. Then we also have what's called Q level assessments. And level Q assessments require a training background in a specific test. So a really good example of this is the Rorschach inkblot test, which we'll talk about further into this course. But the Rorschach inkblot test, in order to be administered, actually requires you to take very specific trainings on the assessment and provide specific background information. So you have to do supervised assessments, you have to have them reviewed by trained clinicians, and only after those things have been assessed can you start to independently administer a Rorschach inkblot test. And that is what we consider a level Q assessment. And typically, individuals who graduate from a program that is accredited by CACREP, or the Council for Accreditation of Counseling and Related Education Programs, are equipped to use level A and level B tests because the qualifications for these levels are written into the standards for a CACREP program. If you are graduating from a program that is not CACREP but is LPC by equivalency, like CSU, most often you're required to pass the National Counselor Certification exam in order to verify your understanding and your standardization of these assessment skills. So then being able to use level A and level B assessments. But it's interesting and important to keep in mind that all states recognize counselors as having testing and assessment within their scope of practice, but there are some licensure boards for disciplines outside of counseling that will try to restrict some of the tests that counselors can administer. Or they might say that counselors are required to receive specialized training. And there is a specific coalition by the name of the Fair Access Coalition on Testing, which is oftentimes just abbreviated as FACT, that serves as an advocacy group to fight these efforts that try to restrict testing. In essence, FACT advocates argue that as long as you have an appropriate level of education, training, and experience, you have the right and capacity to use assessments no matter the profession in which you're using them. And the whole thing that FACT is trying to do is trying to make sure that as clinicians, we are able to use assessments that are going to benefit our clients, because trying to prohibit the use of assessments is really going to hurt our clients more than anyone else. Further within the key ethical and legal considerations is client welfare. And client welfare is another ethical consideration for counselors, because some assessment related issues that affect clients include things like client privacy and confidentiality. There are problems when it comes to confidentiality and assessment, primarily when a counselor is employed by an institution or an organization, which can create a conflicting loyalty to the client and to the institution or organization. In these circumstances, counselors should tell clients in advance how their assessment results will be used and make clear the limits of confidentiality. So for y'all who are in school right now, this is particularly important because most of the time you are going to be operating under someone else's license, or you are going to be supervised on a provisional license. So you have to clearly articulate that information to the client in the informed consent process and let them know, hey, I'm still under supervision. That means that what we do in session is going to be discussed with my supervisor or with the person who is signing off on my hours. And that means that I have to tell them what's going on. Outside of that person, I will maintain your privacy and confidentiality. Present that information to the client so that they can make an informed decision about whether or not they want to move forward with assessment given that information in mind. We also see client welfare issues come up in the quality of test interpretation, particularly around computer-generated reports, because clients, of course, have a right to know their assessment results. And they, included in those assessment results, have a right to the interpretation of those results. And those interpretations need to be communicated in a language that they can clearly understand. So at a level that matches their insight, at a reading level that matches what they are at, and in a way that they can interpret their results in a way that makes sense to them, so that they know what it means and they know what it does not mean. So as a clinician, it's important for you to make sure that the client is reaching the important findings of your assessment. You don't want your clients to reach unwarranted conclusions from the interpretations that they receive. And this is particularly important when it comes to computer interpretations, because as our society has sort of moved into a heavy technology focus, publishing companies have done the same. A lot of test publishers have incorporated online testing materials where a client can take an assessment at home and get their results immediately. And they're very fast, and those assessment results that are computer based are based on norms for all people who have taken that test. The problem with these computer based assessments is that a lot of times they're not necessarily very appropriate for an individual client. In other words, a computer score output is going to have these very broad generalizations or interpretations of the client's scores. And as a clinician, it's your responsibility to take that information in conjunction with your professional judgment and make informed decisions about what the client's results mean in the context of that client's life. So that means that you need to type up a narrative from that computer based score report that evaluates what you know about the client, the rationale of the test, and even the reasons for the evaluation. In fact, I hope that you hear this more times than you don't, but you should never ever directly copy and paste a scoring output from a computer generated score and copy it into an assessment report that you're going to give to a client. That is completely unethical, and most often it's going to be inappropriate to the client because it's not taking the client's individuality into consideration. So again, never ever copy a score report that is generated by a computer word for word and paste it into an assessment report. Instead, it is your responsibility as a clinician to use your professional judgment and interpret and sort of almost even translate that information into the context of what you know to be true about the client, why they're seeking that assessment, and their rationale for testing, and then provide them with an output that makes sense for them. And the final area of client welfare that I want to talk to y'all about is the use of assessment data in research. So, oftentimes, we have assessments that are given for research purposes where we're only doing it to learn about this client. And there's no necessarily specific output like in a court or in regards to treatment. Rather, we're just using the assessment to learn more about research of that assessment. And when you are doing that, it is our responsibility as the testing clinician to engage in informed consent with the client. Have the procedures of the assessment explained to the client, let them make the opportunity to choose whether or not they want to participate based on all of the information, any risks that could come to them, any benefits that could come to them, any ways that they're being compensated for their participation. They need to make an informed decision about whether or not to participate. So it is your responsibility as the assessor to provide the client with informed consent on why this test is being used for research purposes. We also have what we call professional issues in assessment. And these are things that aren't necessarily unethical for us, but are rather things that are likely to come up the more often that you use assessment in your everyday clinician work. So, one of those is technology and how it influences and is being used in testing. So, I already highlighted this already, but there is an influx of assessments being used via technology. So, having testing that takes place on a computer. And there are some benefits to that. Namely, if you can have technology or computer based testing, it's oftentimes lower cost, it's faster, and it's more efficient for clients. But it's not without its challenges. Namely, a lot of clients may struggle if they have a language barrier. And for some clients, the general test security and psychometric concerns can be affected by this. And we might not always recognize that as the testing clinician. So we don't always know if a client takes the test at home, we don't know the environment in which they took the test. If they were distracted in any way, we don't know if they understood the instructions. We don't know if someone else helped them with the items, and all of that information can change the reliability and the validity of our tests. So, even though there are benefits to technology based testing, there are also drawbacks, and it's almost our responsibility to make an informed decision about whether or not we feel that a client has the ability to do computer based testing. And even if they tell us no, knowing them in context and being able to assess if that's an accurate insight into our client's experience. We also have a professional issue around the counseling process because as counselors, we need to share assessment results with our clients so that we can facilitate the counseling process. And counselors are to share findings in a manner that foster client self-awareness and decision making while understanding the client's frame of reference for the testing process while also reflecting on the implications of the assessment process. So, as clinicians, it's our responsibility to hold that information at once. We need to present our clients with the information in a way that provides them with self awareness and decision making in the context of their entire life and the functional impact of our results. Also, as clinicians, one of the challenges that come up in communicating assessment findings during the counseling process is that a lot of validity evidence for different assessments is based on groups. And most historically, the primary group that assessments have been normed on is white, middle aged men in the United States or of European descent. And that means that if we are going to use an assessment that has been normed on this group, has been validated with this group, we have to interpret our scores for a client who doesn't fall into that category in different ways. We need to make an informed decision and make sure that we are only using assessments that make sense for our client or at least interpreting them with caution when our clients' identities are not reflected in the validated norm-based group. Also, as counselors, we have to be aware of the influence of test anxiety. Test anxiety is a significant issue, particularly in ability testing, because there is a direct relationship between higher test anxiety and lower test scores. So, as counselors, we need to assess the role of test anxiety in a client's life, as well as how previous test scores might link to future test anxiety. So, in other words, we need to pay attention to whether or not a client's test anxiety is going to interfere with the validity of the scores that we're looking at. But we also need to take into consideration that if a client is having difficulty with test anxiety with us, they are likely also experiencing testing anxiety in other testing settings. So, whether that's in school or in placement tests or even at their job. So, if that is true, if they're experiencing that test anxiety across the board, we can use that information to inform what we're going to do with our assessment results. Also, as clinicians, we need to emphasize to clients adequate preparation for tests and teach them cognitive behavioral techniques that might help them manage their anxiety. So, that can be teaching them thought stopping techniques or even ways of challenging irrational beliefs. It also helps to teach clients desensitization techniques, and even encouraging relaxation exercises before tests can help mitigate some testing anxiety. And the final professional issue that I want to talk with y'all about is coaching. And coaching refers to the use of professional test preparation services in the form of workshops, software, practice tests, and books. And although some coaching firms promise significant increases in test scores, oftentimes practice efforts can lead to a naturally increased test score. A practice effect it refers to the familiarity that someone has with the type of problems and the problem solving skills required for a test. And the more often that they're exposed to it and the knowledge that they have of those aspects increases their testing scores because they know what's being expected of them, so they know how to perform. Controversy oftentimes comes up around coaching because a lot of times these companies don't have a control group to support their claims that their testing methods or that their coaching methods will actually lead to increased test scores. Also, the validity of a test can decrease for people who have been coached. I like to think about this in the context of education because we're all students right now, or at least in an academic setting. If you teach someone how to do a math problem and you give them an opportunity to practice it over and over again, they're going to develop skills. But if you just tell the student, here are the exact math problems that you're going to be asked about, and here are the exact answers, they're not actually going to learn, and their results on the test are not going to be an accurate representation of their abilities in math. In other words, their validity has been compromised. And that's true with some coaching methods. Some coaching firms will provide students with exact outputs or exact copies of assessments so that they know how to perform quote unquote to their best. And that ruins the validity of the test and it makes it so that we're not actually getting an accurate representation of someone's skills. So, that is where we're going to wrap up the professional issues in assessment. And like all chapters, I have a review slide for you that you can use while studying to make sure that you're understanding the primary concepts of chapter 3. In other words, I will see you in the next lecture.